this morning, right?
Yeah, you want to curse me out. She was like, don't freak out on me when you see me. I was like, what are you talking about?
Doug's like, what are you doing with all that shit? I was like, I got an interview because your girl Marnie screwed me over again.
What did he say?
He's like, okay.
He does not care.
No.
I think we got it.
Go ahead.
Just look at me.
Okay. That's easy.
Oh, can you hide that cable there under your jacket?
Oh,
Yep.
better?
Yeah, yep.
I'll show you my boob and then you're really bad.
Right.
What is that? Nibbling.
And then if you can kind of turn your shoulders a little bit toward me. There you go,
This
right.
way.
That's perfect.
Just relax, sit back, chill. Okay. Tell me when.
Okay.
So I always have to start with your name and your title.
Okay. Erin Borders, Director of Business Development and Outpatient Services.
Okay. That's just so he'll know he's doing what.
Sorry, I forgot my title today.
That's not gonna even be on the thing. So
Can you
how?
spell your name too?
ErinBorders.
Huh? So what is your role at here?
So currently I'm responsible for all outpatient clinics, the ones that we have here at Loretto in the hospital, and then one that we have in Oak Park and another one that we have in Berwyn, as well as trying to formulate new business development in terms of programs that we have.
And how long have you worked here?
It'll be 5 years in July.
So how has it been since you been working here, like when you first came and the way it is now?
So when I first came here, things were quite different, and my role was a little bit more limited than it is now. But since Mr. Miller started back in 2018, Loretto has really taken off, and I think we've found our path to actually being committed to our mission and our vision. For example, we did open 2 new clinics within the past year, and that's to align itself with Mr. Miller's vision that we're going to reach as many people as possible so that we can provide them wellness care and preventive care to make sure our community is in a better place health-wise than it has been in the past.
And what can you share a little more about the expansion as far as Oak Park and, do you think it's working?
So I think that immediate care, which is in Oak Park, is working because it affords the community more time and availability to see a provider. So we are open Sunday through Saturday. We're open in the evening. So that allows people who normally wouldn't be able to come to what is a typical doctor's office hours day. If they're working and maybe they can't see a doctor until 6 o'clock at night, we're there at 6 o'clock at night. If they work Monday through Friday and they can't get off of work, they can come on Saturday and Sunday. In addition to that, it prevents hopefully people from going to the emergency room. Whereas they would normally go to the emergency room for a cough or a cold or a fever, bug bite, they can come to immediate care and get those services. And that way it is less money for them, which is what we're trying to do as well. And it keeps them out of waiting in the emergency department for a really long time. They can get service right away for those type of things.
So thorough. And you already answered that question. So how do you see our community and patients benefiting from our overall expansion?
Well, I think that especially recently, Loretto has put a lot of different programs in place, like the diabetic education program that Nancy does. We've expanded our services to vascular services. We have a lot of people in our community who come to Loretto in the clinic as well as inpatient who have heart disease. The vascular program allows those folks to come here to get some of those heart disease related illnesses taken care of in our vascular program. We just added on a retina specialist, and in our community, diabetes is a very high incident rate. So a lot of disease related to the eye is a result of having diabetes, and hopefully the retina specialist can help treat those eye diseases and prevent folks with diabetes from losing their eyesight. So those are just a few examples.
I think that's it. And if you had to say one good thing, think hard, about Loretto Hospital to the community, what would you say?
We have Mrs. Illinois.
Other than that, you're about to have Mrs. International. For sister.
All right.
Okay.
I think the community should know that we're here to help them no matter what, whether it's mental illness that they're dealing with, a physical illness. We have some social services that would be able to help them. So this is really a one-stop shop where they can come for all their health needs with people who really care about them and want to make a difference for them.
That's hot.
Good, yeah.
I gotta remember to flag that.
I have one question.
I gotta flag that.
You know, when we're talking about the expansion, that's really important. You know, you're reaching out to many people west of Central, and you're reaching into different communities, helping people out. I think that's really important. You want to say something like that?
Sure.
Yeah.
Okay. So Mr. Miller, when he came, you know, is very concerned about the health disparities, especially in the Austin community in Chicago. So in line with his vision to make sure that we're reaching out to the surrounding communities, we did open a family practice or acquired a family practice clinic in Berwyn, so that we can reach folks who are in the surrounding suburbs as well as just the Austin community. Because as we all know, you know, there are socioeconomic differences between downtown Chicago, Austin community, Cicero, Berwyn, even Oak Park. So having expanded services in the family practice realm in Berwyn will hopefully help reach more of those folks who need help, need to be educated in health maintenance, and actually come to Loretto for any extra services that they may need, like imaging, lab, vascular, etc.
All right. And what about the Oak Park location? Can you touch on that as well?
Sure. So in Oak Park, we do have an immediate care center, but we also have a family practice tract where people who live in Oak Park or the surrounding communities over there can have a primary care doctor that is affiliated with Loretto. So if need be, they could get all the services that they would need because they're affiliated at Loretto.
And would it be fair to say that you hope that there's even more expansion to reach out to even more people?
Yes.
Would you mind saying?
Elaborate on that.
Yeah. So currently the goal is to continue to expand the outpatient clinics. So we are looking at where those clinics should be so that we can help the most people as possible in the surrounding areas, whether it's Austin, Cicero, Berwyn, Oak Park, and North Lawndale.
You mind saying that one more time?
Sure. So we are currently looking at continuing to expand the outpatient clinics so that we can make sure that we're helping as many people in the surrounding communities as possible. So we are looking to identify where that clinic or those clinics would be best serving the community. So we're looking at other places in North Lawndale, Berwyn, Cicero, and even further north into the city of Chicago.
Right.
Okay, so I need to just FYI, you got to get out of not letting me use you because you're well spoken, and sometimes I need more people.
That's fine. I'll do it for you, you know I'll do it.
Okay,
It's just
because
gonna
what-
take a minute